Well, welcome back to Athlon Medical's a channel addressing unmet needs in global health. And joining to discuss the recent oncology trial in Australia and the financials and give us a broad view of the company. Of course, we have James, the CEO, and of course, Stephen, the Chief Medical Officer, joining. First and foremost, welcome, gentlemen.
Thank you, Kyle. Nice to be with you again. And thanks to the listeners for spending part of your busy day learning a little more about Athlon Medical. We've had some good activity on our oncology trials. I'll let Dr. LaRosa here give you an update, but we've been working on this hard for a few years, and it's great to see some tangible progress. Steve?
Yeah, sure. Just as a reminder, we have the Athlon Hemopurifier, which is a device that's in a safety, feasibility, and dose-finding trial in patients with solid tumors who are failing anti-PD-1 therapies. We have a trial that's recruiting in Australia, and we're happy to report that we've enrolled 3 patients in the study to date. 2 of the patients did not advance to the Hemopurifier treatment phase because they either one patient had responded to anti-PD-1 therapy and one had had toxicity from their anti-PD-1 therapy. But we did treat our first patient with the Hemopurifier on January 29th of this year. We're happy to report that the patient tolerated the full 4-hour treatment procedure. There were no complications with the device and no complications with the patient. The patient came back for his 7-day pre-specified safety follow-up appointment, and his laboratories revealed no clinically significant changes in labs and no adverse events. So a successful first treatment from a safety perspective. Once we have 3 patients who've received the Hemopurifier in the first cohort, the Data Safety Monitoring Board will review it, and if these patients have a similar experience as the first patient, we'll proceed to a second cohort where the patients get 2 Hemopurifier treatments in a given week. We'll also get data after the 3 patients. We'll also get data from our lab on the reduction in extracellular vesicle concentrations and any resulting improvement in anti-tumor T cell numbers following. So those would really be the next pieces of data that we look forward to. One additional thing that I think we should talk about is some changes that we made to the protocol in an amendment at the suggestion of our investigators. So we've done some things that we think will potentially improve enrollment rates, shorten the time to getting Hemopurifier treatments, and shorten the time to getting a data readout. These include going from enrolling patients newly on anti-PD-1 therapy to those who are documented to be failing therapy without the 2-month run-in period. So these patients should be easier to identify quickly and also will not have a 2-month delay until they get the Hemopurifier. Furthermore, we've removed some restrictions on some concomitant medications, commonly used concomitant medications, and those are often reasons for screening failures. Again, these were medications that the investigators thought could be included and would have no impact on patient safety. And then finally, we, in the amendment, allowed all the approved dosing regimens for pembrolizumab and nivolumab. So in the initial construct of the study, because we were enrolling newly started patients on these therapies, we only had allowed 1 dosing regimen, but now the patients on any dosing regimen. So all these should increase the patient pool to draw from in the study.
We should mention we're bringing on a 3rd hospital in Australia, Steve.
Yeah. So we have 2 sites that are actively recruiting. After today's site initiation visit at Royal North Shore Hospital, Genesis Care is the research unit there. After they complete their site initiation visit today, they will be active in recruiting, and they have a large patient population in Sydney, which is obviously a large population in Australia. So that all should open the patient pool and improve enrollment.
Yeah, definitely appreciate all the insights here, gentlemen. Do you want to bleed a little bit into the financial side and give us kind of an outlook from there?
Sure. We just disclosed our December numbers yesterday. We filed our 10-Q quarterly report and held our earnings call. We ended December with $4.8 million in cash, no debt of any sort on the balance sheet. Actually, that's our third quarter. That we're on a March 31 fiscal year. So Q3 over Q3, December 24 over December 23, we actually cut our expenses in half, even though the G&A expenses associated with the clinical trials are ramping up. But we've significantly reduced payroll and professional fees, and we've basically extended our cash runway. And because we know as the trials progress and more patients are treated, those costs will go up. So this was all part of our plan, and it's gratifying to see it actually showing up on paper now. I would be remiss if we didn't talk a little bit about viruses. People are welcome to look at our 10Q and contact us with questions on the financial side. But the company's original basis was in treating viruses. I focused the company on cancer the last few years because that's a set need. A lot of people, and regrettably, many people have it or are going to get it, and it's something we can train for and make progress with. With viruses, you're basically waiting for an outbreak of some sort, and I use this analogy a lot, but I think it's relevant. The company used to be like a firehouse, so we were a bunch of firemen with our device ready to help with viruses. And if the viruses didn't happen, we were just burning cash waiting for somebody to approach us. Now we're proactively working on cancer, but we're not giving, they're still very applicable to viruses. And there have been some interesting outbreaks that perhaps we can help with. Steve, do you want to touch on the current ones that are cropping up in the news?
Sure. So bird flu, I'm sure everybody's following H5N1 infection. There's been obviously the poultry and cattle population, but we're seeing a number of human cases, including a death. We have previously generated in vitro binding data that our device effectively removes H5N1. So if currently available medications ultimately fail, we would potentially be waiting in the wings. There's a Marburg virus, so a hemorrhagic fever virus that's in an outbreak in Tanzania. And there's no approved treatment or vaccine for Marburg. And we have in vitro removal data that we've previously published. And also Ebola. There's an Ebola outbreak in Uganda right now, and we've previously had both in vitro and as well as have treated a patient under emergency use with Ebola with reduction in viral load and clinical improvement. So as Jim said, we're poised, and if currently available treatment strategies don't work, we should keep in mind our viral roots, as we say.
Right.
On that note, I definitely appreciate the updates today, gentlemen. As we pass it off to the viewers, as always, we'd love to know what you think. And consider subscribing as News Catalyst. Operational updates come down the wire like this. Of course, we'll bring them to you here. But on that note, we look forward to catching you in the next one.